Hello everybody and welcome. I'm Dr. Taz with OldFashion Health, good health from the inside and out. We want to take some time today to talk about your recent doctor visit. The last time you went to the doctor, did you get a medication? Did you get a diagnosis? Well, a recent report out suggests that many Americans today are getting overdiagnosed. What does that mean? Well, you're walking in for maybe your routine physical and you're coming out with a new diagnosis that you didn't really expect to have. What's the concern with overdiagnosis, you may ask, and why is that a problem? After all, don't we go to the doctor to make sure we're okay? Well, overdiagnosis is resulting in overprescription of medications and maybe too many surgeries or procedures being done a little bit too early in the course of your disease or your illness. What we're finding is that things like high blood pressure, diabetes, many physicians are calling those very early and putting patients on medications very quickly. Now, again, as a physician, I don't blame them because we have limited options when we restrict ourselves to conventional medicine. But what we're finding is that many of these issues, like high blood pressure, like diabetes, or even obesity, can be prevented and changed with lifestyle modifications and good preventive strategies. The challenge, though, for physicians is that often they don't have the time to spend in the room going through what you ate the day before, how you slept, what your life might be like. So really, when you walk into that doctor's office, it's important to remember that if you're getting a new diagnosis, ask your doctor first. Are there other things that you could be doing within your life that may really make a difference? Should you change your diet? Should you add a few supplements? Should you exercise differently? Or if you're not exercising, is that time to begin that? Should you work more on maybe stress management or the mind-body component? Would any of those things shift something like blood pressure numbers? For many of the women in my practice, I talk to them all the time, I feel like, about cancer and cancer prevention. So many women go into the doctor for that routine mammogram and come out with news that they're just devastated in. But what we find is that sometimes the mammograms have been overread or overcalled, and women find themselves on a journey towards chemotherapy, radiation, surgeries, which really may not have been necessary. So what do? You walk into that doctor, you want those screening tests. Well, rule number one is really think about how you can prevent breast cancer. And again, that's a conversation that winds you and leads you right back to your diet, to your exercise, and to tracking your hormone levels year to year. So overdiagnosis is the result of doctors trying to be super proactive, but having a limited scope and limited options to offer to patients as they're trying to prevent them from terrible diseases. So prevention is key, but remember, prevention is food, diet, lifestyle, sleep, your spiritual makeup, your community. All of that determines the course of a disease, not just the medication you may receive on a given day. So have a great conversation with your doctor, educate yourself, be your health advocate. I'm here to help as well. Thanks for watching. I'm Dr. Taz with OldFashion Health, good health from the inside and out.